I'm going to be talking about, because this is a session on climate change assessment, we talk about all the negative impacts from climate change, and I'm actually talking about the opposite, which is the potential health benefits, or we call them co-benefits because you're doing the policy to avert climate change, but on the side you get co-benefits to health. So I'm going to talk about the health co-benefits of climate mitigation policy. And I do want to just mention that all of these climate-sensitive areas, we've been talking about these for a long time. This is a pretty old slide. And this afternoon we'll be talking about vector-borne and waterborne diseases. But I'm not going to talk about this because we've had discussion, although I do want to say that we're learning more and more. For example, just recently there were 2 studies that came out that storm surges and increased sea level rise and salination of freshwater aquifers in Asia is leading to hypertension and preeclampsia, which of course is very severe and dangerous. So there are studies like that that are new to this graphic, so we have to be aware of that. I do want to point out, we've talked a lot about problems around the rest of the world. Just a quick mention before I talk about co-benefits that even in our country, and this is, Jerry teed me up perfectly to talk about extremes, we've been using the extremes toolkits out of NCAR at our Climate Research Center in Wisconsin. And one thing that we have found for cities, all cities east of the Mississippi, is that they're going to experience many more hot days. For example, here, New York City only has 13 days on average that are 90 degrees or hotter. So New York has 13 days of temperatures 90 or hotter. But by mid-century, that number will triple. So instead of 13 days, we'll see 39 days. So this is the climate system on steroids, looking at extreme heat waves. This holds up for every major city east of the Mississippi, although Atlanta only increased 2.5 times. So you'll be lucky. Yeah. Okay. So anyway, and then the other thing, and this will be talked about more this afternoon. Of course, climate change is not just temperature; it's extremes of the hydrologic cycle. And when it rains, it's going to pour. This is what you all know. We've already done some analysis for example, the Chicago area will experience twice as many combined sewage overflows because of this intense rainfall. But I'm not going to, I'll talk about one other emerging thing because it's relevant. This year we had a record number of cases of dengue fever in Latin America, and this Zika epidemic emerged. We'll hear about that from this afternoon from Andy. But going back to a study that looked at Southeast Asia, 18 years of dengue fever data found this synchrony of very big epidemics. And those were during the very big El Nino years, especially 1997 and 97, 98 El Nino. But this past El Nino, and the climatologists, please, I know that you're not committing to this yet, but this last El Nino, it's at least on par with 1997, 98, but lasting longer. So I don't know if you call that historic, the strongest El Nino in recent history. I'll leave that to you guys, but it was a very strong event. So we're looking at the temperature implications from that El Nino, and we're working on that right now, looking at Zika and El Nino. One last thing that I made a comment that as we look at specific health outcomes and specific diseases, that in many cases it's going to be the society-wide impacts of climate disruption that could have the biggest effect. And this is one not proven, but just an observation that if you look at Syria and you look at trends in rainfall and drought index in combination with their increasing population, right before their civil war, they had the most severe drought in the instrumental record. There were food price shocks. Did this have anything to do with the Civil War? Of course, that's 400,000 people dead and millions of refugees. These are the types of things that are really difficult to study and to attribute that severe event to what happened later. But these are big outcomes. They're indirect effects. And these are the ones that could be the iceberg under the tip of the iceberg as we talk about every single different disease that's climate sensitive. These are the things we also have to be extremely aware of. So I'm not going to talk about that anymore. This is what I'm supposed to talk about, and that is climate change policy. And the Conference of the Parties in Paris last December was historic. In fact, there were more heads of state in one place at one time ever in history at that meeting. And most countries of the world came into the conference with written out intended policies to reduce greenhouse gases. And these are some examples from the Conference of the Parties right before Paris. You can see Japan and Australia, the US, talking about a quarter or so decreases in greenhouse gas levels by the year 2030. EU, 40%. Ethiopia, 64% reduction from business as usual. So these were very big commitments coming into the meeting. Now, as Jay pointed out in day one, those commitments, this is, and Jerry just showed this as well, this is business as usual. This is with those commitments. Those are big commitments, but still we're going to get warming up to 3.5. And as Jay pointed out yesterday, to really get below 2 degrees centigrade, which is the target agreed upon in Paris, that's going to take a lot of effort. And I'm here to tell you that using the public health argument, the health argument can really help convince policymakers to take that pathway, because we really do need the immediate and substantial actions. So could policy to combat climate change be cost-free, or with the public health co-benefits that will accrue from these policies? It could make climate change mitigation a net gain. So I'm going to give you some statistics of which you know mostly already. You know that 7 million people die prematurely every year from air pollution. This is from indoor and outdoor air pollution combined. And this is a new statistic out of the Global Burden of Disease, that more than 3 million people die every year from physical inactivity. And as more of the world is adopting a Western lifestyle and getting more cars, and cities are designed for motorized transport rather than for active transport, this is a problem. And finally, we all know that there's cardiovascular risk from high meat diet, and of course a high meat diet means more environmental impacts. So let me start with the first one about air pollution. And this is something, George, I don't know if you were involved with this study, but this is something that is one of these duh moments, right? You reduce air pollution, you get better health outcomes. For the Olympics in 1996 in Atlanta, they had rules to reduce traffic, to have cleaner air for the athletes. Traffic fell by 23%. Ozone levels fell by 28%. No surprise. Get the cars off the road, cleaner air. Guess what? The asthma-related ER visits by children decreased by 42%. Now you might say that, well, wait, less people driving to the emergency room, but these were colleagues of George's who are smart epidemiologists, so they controlled for that and found that children ER visits for non-asthma causes did not change. So cars off the road, cleaner air, less asthma. We know these things. But this is where it's really important to understand that the health outcomes from different energy policies really can add up significantly. And as people are arguing about, can we really afford a green energy society, a green economy, a low carbon economy, we need to look at the outcomes and weigh both sides. So this is a study out of MIT showing that looking at the air quality co-benefits from a low carbon energy policy for the country. And out of their abstract, here's a quote, that the health benefits from reduced PM 2.5 pollution, the health benefits can offset the upfront cost of clean technology 26 to 1,050%. In other words, the health benefits might be valued 10 times more than the initial cost of paying for solar and wind and all the renewables. So this is something extremely important for policymakers to understand. Similarly, if you look at the cost of cleaning up, of reducing CO2 emissions, for every ton of CO2 that you pull out of the atmosphere, when you burn fossil fuel, it's greenhouse gases, but it's also nasty PM 2.5, nitrogen dioxide, sulfur dioxide, all the nasty pollutants that we know harm people. So for every ton of CO2 that you pull out, you're also pulling out conventional pollution that harms people. Notice this is only half of the slide, right? Because if you weigh, those pollutants that are removed, for every ton of CO2 that you remove, you would get on average $200 in health benefits from avoided mortality and avoided hospitalizations from PM 2.5 exposure. And so I always ask policymakers to say, okay, here's a tough question for you. Which number is bigger, $30 or $200? And so when everyone is focused on, like, we don't want to pay for that expensive energy, and get to clean energy, that's going to cost, who wants to pay $30 for cleaner, reducing greenhouse gas emissions? But guess what? There's a huge dividend. And if you live in polluted places, like in parts of China and India, and East Asia, these benefits are even higher, up to 70 times greater. So this is a slide that is extremely important in this day and age when we talk about, is it worth going after climate change mitigation right now? And this is where the public health argument is important. The other thing, the reality that solar energy has dropped, the price has dropped 99% since the late 1970s, so it's feasible. One more this is a little bit confusing, but one more added co-benefit is mercury exposure. When you burn coal, you get mercury. That's very dangerous for health. These are numbers as far as the amount of mercury emissions. If you were just to put more mercury regulations, but if you were to actually get rid of coal completely, you get much, much less mercury. So another side benefit. So I want to quickly shift gears to that other number about, remember, 3.2 million people die prematurely from physical inactivity. One consequence of physical inactivity is overweight and obesity. And this was just published this spring in the journal Lancet. The trends in adult body mass index, they looked at 200 countries from 1975 to 2014 with almost 20 million people. So this is a really tough one to look at, but it is really all around the world. This is a severe epidemic in the United States. This is termed the #1 epidemic in the United States, is that of obesity. On top, this is obese men, obese women. This is severely obese men, severely obese women. In every region of the world, this is a problem. And I would attribute some of this not only to the types of food we eat, but how we design cities. And if you look at this neighborhood, that's a neighborhood designed for cars, not for people. It's not health promoting. It's not physical fitness promoting. It's contrary to a livable city. And if you look at statistics from the Department of, from our health department, 60% of Americans do not meet recommended levels of aerobic exercise. And if you look at the Department of Transportation, 40% of trips are less than 3 kilometers or less than 2 miles. So, amazingly widespread problem. But what a golden opportunity. Wow, a lot of trips are short car trips. So we did an analysis for our region of the world. We looked at the 11 largest cities in the upper Midwest, and we asked the question, okay, we can map where the cars are. We can map their tailpipe emissions. We can do atmospheric modeling. This is Tracy Holloway doing the atmospheric air pollution modeling, and superimpose that over where people live and ask the question, what if we remove those short car trips in the metropolitan areas of these 11 cities and measured that reduction in pollution and what it means for health using an EPA BenMap model, benefits mapping analysis. And so we asked that question, what would that improvement mean for health? The second stage is then we say, well, what if we assume that these short car trips, one half of those short car trips could be done by bicycle and only in the summertime. So forget the studded snow tires, just summertime, half of the short car trips. What would that physical fitness benefit be? And if you combine these, it turns out that swapping tailpipes for pedals could be a huge benefit. This is not quite the right number. It's about 1,300 lives would be saved every year. That's equivalent to $8 billion in avoided mortality and health costs every year for this region by getting rid of swapping those short car trips for bike trips. And if you look at U.S. cities and you compare those with the highest bikeability, biking rates versus those with the lowest walking and cycling rates, that these active transport cities have obesity rates 20% lower and diabetes rates 23% lower than cities with the worst levels of walking and biking. And these have been replicated around the world. These are studies. This is out of the UK, looking at the benefit of active travel by bicycling. I can tell you about the injuries and stuff later, in questions. But you have to design safe ways to get around for active transport. But look at these savings, across the board: heart disease, strokes, dementia, breast cancer, and even crashes go down. So, big opportunity. In the last one, the food system. There are co-benefits if we get to a better food system. Yeah, if you can read that in the back, I am full of greenhouse gas. Do you have a stake in it? Okay. This was during the People's Climate March in New York, the UN Summit on Climate Change. And this is, again, a slide that should be obvious to most of you. This is looking at a high-meat diet and the CO2 equivalents as far as producing a kilogram of protein. What's the environmental impact? And high-meat diet, low-meat diet, fish, vegetarian, vegan. So eating lower on the food chain is good for the environment, but it's also good for our health. A study in the UK showed that if you have meat consumption, that of course you'd have reduction in CO2 emissions, but also saturated fat would fall by 40%. So that's a health, co-benefit. Same as a study in Brazil showed, the saturated fat would fall, or the heart disease risk would fall by 15%. So I'll wrap up and just say that, these areas are ripe for action. And if you look at, a low carbon economy, it seems like, we're addicted to fossil fuels and there's a lot of reluctance to get to a low carbon society. But if you argue the health benefit from those actions, and I'm not going to show the cartoon that everyone always sees. You see the climate denier saying, what if climate change is a hoax and we improve society and children's lives and walkability and air pollution, and we do it for nothing? You've seen that slide, so I'm not showing it. But that a low carbon economy can make us healthier and also save money, especially in these domains of energy production, thinking about air quality, transportation and urban planning, thinking about how we move around and how we actually get more exercise, and of course, food systems. So with that, I thank you very much for your attention, and I want you to please, you can follow me on Twitter, and also, if you're interested, I did bring the book, our book that I do not want to carry at home on the airplane. And this is, in fact, the RCP 4.5 map on the cover. Thank you.
We have time for a couple of questions. Lee?
I have an announcement and a question for you. Great talk, Jonathan. Loved
Thanks.
it. And thank you for the book. We carpooled on our way up here on Sunday, but there's room in my car coming back Friday afternoon. So if anybody needs a ride, please do see me this week. Now to my question. And the question is, and I'm sure you get this, it's coming out of one guy's pocket, one group's pocket to pay for it, and when you do the return on investment, the return on the investment is accruing to maybe someone else who, it doesn't feel like, who benefits, but they're not the ones who paid out of pocket to get the reductions. How do we deal with that? I mean, it's a terrible world that we're in, right, where we can't see the big picture. How do you deal with that?
Right. So that's
two different audiences.
That's the winners and the losers are different. I have two answers to that. One is that when you recognize when you bring in these external costs to the environment and the health costs of burning fossil fuels, what industry do you know that doesn't have to pay for its waste? I think the fossil fuel industry is about it. They don't have to pay for when you burn that gallon of gasoline, it goes in the air and it causes, they don't pay for that. Society pays for it. The governments pay for it. So this is one where, just like how we have the many environmental laws that we have on the books, this is a role of government to say, yes, you're harming a lot, you're harming society, you're harming our economy, and you're making a lot of money. This is, and you're not going to win. These carbon policies are not going to help the fossil fuel industry. This is where there is an important role for government. That's my first answer. The second answer is that I don't necessarily have full confidence in government interventions at the national level or the international agencies. And this is where I say that a grassroots recognition and understanding of benefits that are happening all around the world, especially in cities. And it's the mayors and also industry leaders that are saying, wow, why didn't we take methane from the landfill before? We're saving so much money. And the cities are saying, why didn't we restrict those roads and have more walking malls? It's really increasing the visitation and economy. So it's these local areas recognizing that there's benefit to be made. So good question, and that's a half okay answer. I don't know.
I'm going to search for the other half of the answer.
Oh, good.
I was going to ask a question somewhat like these, but I was thinking about the article in the Sunday New York Times about the support for Trump in Appalachia. And I was thinking about Appalachia is going down the tubes because coal is going down the tubes. And I don't know how you can talk to those people in rural and some urban areas there where the costs of changing, it strikes me, it seems to me, and I'd love you to show me wrong, but the cost of changing from a fossil fuel to a non-fossil fuel based economy will directly benefit that portion of our country.
Right. So things change. I mean, you look at the technology in Africa, they leapfrog technology. They're not building phone lines. They went straight to cell phones, things like that. There are some sectors, I think, that are absolutely, the coal industry needs to just disappear. And that's where there needs to be fair, equitable approaches so that there needs to be support for coal miners. There needs to be, economic diversification, job training, things like that. And there will be resistance. But this is where I think there has to be very intentional, equitable approaches, like the fee and dividend. A fee for carbon, giving it back to the population. Well, who drives the most gas-guzzling cars? It's poor people, right? So there has to be, well-designed approaches that don't disadvantage people that are already disadvantaged. I don't have an answer for the coal miners other than, as we approach, we don't want to leave people behind. So there needs to be a focus on, well, what could we do to get away from it? It's going to take some extra thought and extra planning.
Okay, why don't we have...